This is a support group for the sufferers of one of the most feared diseases in Africa. The people here have drug-resistant TB, a strain so contagious and potentially deadly that the victims are stigmatized and shunned.
We trust you, Lord, and the treatment that we're taking, that together we will be able to defeat the sickness.
Drug-resistant TB, known as MDR or XDR TB, has caused panic in South Africa. Patients are being locked up on hospital isolation wards, held prisoner until they're cured or they die. So this approach in Khayelitsha is controversial. The patients are treated at home and come together like this once a week to share their stories.
I was really sick. When the doctor told me, "You've got a problem, you are resistant in all drugs," the only thing I want to kill myself.
It really made me feel scared. Then I realized that with this support group, there is hope. There is life after this.
Khayelitsha is a prime breeding ground for TB. 500,000 people are crowded into this township, and high rates of HIV have made them more vulnerable to the disease. Look at the number of masks being worn in the medical clinic, an attempt to control an epidemic that's still spreading. Most of the transmission of TB happens before the patients even seek treatment. Before they make it to the clinics, they can be infected for weeks or even months, spreading it to members of their close family and some of their friends, adding to the huge burden on the healthcare system here. Dr. Samiso Sekeli sees 40 patients a day, and she's just one of the doctors in this clinic.
In Khayelitsha, last year we had about 206 drug-resistant TB patients for a population of about 500,000. This year, quarter one, the increase quarter to quarter, comparing quarter one this year and quarter one last year, has been about 87%.
The increase is terrifying, but it's largely down to better detection, a sign that the policy here of not confining people to hospital is leading to more coming forward to be tested.
It was seen as this disease that you have to be put in prison almost, and you're going to stay there and you're going to die there. By giving an example where people can stay at home, get treated at home, and actually do get better when taking treatment, it encourages more people to come forward.
The treatment is tough. 2 years of daily injections and a combination of foul-tasting drugs with vicious side effects. Drug-resistant TB mutated from the ordinary form because people didn't stick to the treatment. So here they have to take their tablets at the clinic, closely observed. Patients are also visited at home, where they're given advice on how to avoid spreading drug-resistant TB to their families. In the case of Bongiwe Mgoshi, her 1-year-old child. Her daughter sleeps with her in the only bedroom, and the window that might provide vital ventilation is covered over and nailed shut. "I'm praying," she told me, "that I'm the only one to get this disease. I'm wearing my mask even at night to try to protect my child." TB in its ordinary form is already a killer, the leading cause of death in the world from a curable infectious disease. The only vaccine, the BCG, is largely ineffective and was developed 80 years ago, so this is long overdue. The trial of new jabs on thousands of volunteers in South Africa.
At the moment, we're actually testing 4 different vaccines at this site. They all look promising. I'm sure we are going to find one of them is going to be the one. And we hope by 2015 we're going to be able to present the winner to the community.
The vaccines have been developed around the world. Big pharmaceutical companies who were reluctant to get involved in a disease that affects poor people have finally pumped money into research. The results of the trials are being monitored here at Cape Town University.
Tuberculosis is a major disease, and if we can prevent tuberculosis, we're going to save millions of lives. We're going to prevent HIV positive people from dying as a consequence of tuberculosis. We're going to prevent the spread of MDR and the spread of XDR. And it will have a major impact in terms of improving the quality of life of people generally.
For now, though, the focus remains on treating the sick and preventing the disease spreading. The patients in the support group are proof that drug-resistant TB can be beaten, but the survival rate across South Africa is still only 50%. Emma Hurd, Sky News in the Western Cape. Emma Hurd, 5 News in the Western Cape.